This is Little Miss. So Little Miss came to us about 5 days ago. So Little Miss came to us with Parvo. Two purposes. Number one is we want to show off Little Miss because we treated her for Parvo and she is fully recovered at this point.
I just wanted to do a little bit about her personality and that I was the one that was treating her in the Parvo ward. Now you see, she's very, very sweet and she was very easy to treat. So I don't want you to think that, oh, you know, maybe she just still doesn't feel well. But she's pretty much made a full recovery and she's eating and drinking on her own, and she was a very quiet little puppy.
The other part of our video this afternoon, this day is smushing together, is to kind of do a little bit of education about parvovirus so that you can protect your pets at home. So Parvo is something that only affects dogs. And it, like I said, it's between 6 weeks to 6 months is when they're the most susceptible to getting sick with Parvo. Parvo is highly contagious virus, and so it can be spread from direct contact from an infected dog to an infected dog, or it can be spread by something called fomites. And so it can take an object like the bottom of your shoe, and you can step and you can spread Parvo on the bottom of your shoe. Or if I pet a dog that has Parvo and then maybe even 30 minutes later I pet a separate dog, then I could potentially spread that virus as well. With treatment, success rates are anywhere between 85 to 90%. Let's talk a little bit about some of the common symptoms. So the Parvo virus is going to attack all the rapidly growing cells in the dog's body. And so the most common signs that you're going to see are going to be digestive symptoms. So that's going to be the vomiting, the diarrhea, and then sometimes as the disease progresses, the diarrhea looks like a melted strawberry milkshake. It's kind of gross, but if you see that, that's pretty unique for Parvo.
Signs.
Yeah, and some of the other cells that it attacks that aren't as obvious to see is the immune system. And so any dog that's suffering from a parvovirus infection is going to decrease their immune system. It's going to make them more susceptible to other infections, more susceptible to septicemia or a bacterial infection in their blood that can be fatal. And then the third set of tissues that parvovirus can attack, it's a little bit less common, but it actually can attack the heart as well. So the heart is one of the more rapidly growing cells in the body. And parvovirus has been known different strains can affect the cardiac tissue as well. Treatment for parvovirus, there is no cure. And so your veterinarian would treat symptomatically. What that means is that when Little Miss was having vomit, we treated her with a nausea medication. When she was having diarrhea, we tried to control the diarrhea. Both vomiting and diarrhea can cause dehydration, so we made sure that she was kept hydrated. We made sure that we were using an antibiotic because, like I just said, it affects their immune system. They can't fight off an infection, and we know that the disease affects the barrier of the intestines, and so that leads them to having some complications from the virus as well. Most dogs are sick for about 5 to 7 days, and as you can imagine, being in the veterinary hospital, or a human hospital for that matter, for 5 to 7 days can be very expensive. And so I certainly would encourage you, especially if you have a puppy, to get pet insurance. Having a relationship with your veterinarian and getting vaccinated by your veterinarian is going to help protect your dog as well. Because most of the manufacturers that sell vaccines to veterinarians will stand behind their vaccine. If your dog is vaccinated by your veterinarian's recommendation and it happens to get sick with Parvo, depending on the circumstances, a lot of times that company will cover the treatment for that dog. But if you get your vaccines from the feed store and you give the vaccine yourself, it's not going to cover it. Even a fully vaccinated puppy, there is a certain window, we call it the window of susceptibility, where even though they're getting vaccines, that they can potentially be vulnerable to the parvovirus. And so because of that, your veterinarian is going to make the recommendation that your puppy, until her or his immune system is mature, that they are not going into public places. So that means that no Petco, no PetSmart, no dog parks, no dog groomers until your puppy has received its full series of puppy vaccines. Now everybody knows how important it is to socialize your puppy, and so I'm not suggesting that you don't socialize your puppy, but a lot of socialization for your puppy can happen in your house with an adult dog that's vaccinated. And so you just don't want to take the risk of exposing your immature puppy the same way you don't want a stranger or even a family member that's sick to hold your baby. So you just want to protect your little baby, your fur child, from getting sick, and it's just a short period of time up until they're about 16 weeks of age.
Are there some common myths about parvo?
I've heard a lot of things about what you can give the puppy, and a lot of people think that if the puppy survives, then that must have been why. And so some of the things I heard was bacon grease, and bacon grease is actually really bad for dogs in general. Another thing I heard is a raw egg. So if you give them a raw egg, that's a cure for parvo. But there are some other home remedies that can be helpful. And so Pedialyte is something that can be helpful, even Pepto-Bismol. But those are things that should be done under the direction of a veterinarian. And if you're doing a home remedy, just understand that this is a fatal disease. But I understand that not everybody can afford a dog in the hospital for 5 to 7 days. A lot of veterinarians offer outpatient care, which means that you would come to the vet clinic and get some injections and get some medication to try to help that dog and give it the best chance of survival. But the very best chance of survival, because this is a preventable disease, is to vaccinate, and until your puppy is 16 weeks of age, you're not taking it out into public places.
Oh, hi, this is so hi.
She's a sweetie.